Thank you. Good. I'd like to say good afternoon to everyone and welcome to the Adam Alliance Quality Innovation Network Learning and Action Network event titled Ways to Improve Your HCAHPS Scores. My name is Don Getter and I'll be your host for this event. And I just want to tell you a little bit about the Adam Alliance. We are a 5-state alliance that's comprised of 3 nonprofit healthcare quality improvement consulting companies. We will contract with the Centers for Medicare and Medicaid Services, in which we partner with healthcare providers, stakeholders, and beneficiaries to accomplish objectives geared toward meeting the National Quality Strategy aim: better, more affordable care, and healthier communities. As part of these efforts, we enable health-eligible clinicians and their groups to better understand and successfully participate in the Quality Payment Program and other quality reporting programs by offering free technical assistance, tools, resources, and educational events. We welcome participants from all of our alliance states, Alabama, Indiana, Kentucky, Mississippi, and Tennessee, as well as anyone else that's been able to join us. I want to give a little overview of how things will work today. Please remember, if you do have any questions or comments, that you can press *9 to raise your hand at any time, and the operator will unmute your line. We really do hope to hear from you today, either in chat or on the call. We are presenting some information, but a lot of this is going to be, the value is you sharing. So your input is incredibly valuable, and we encourage you to do participate. I think we'll all get a lot more out of it. So in addition to pressing *9 to raise your hand, you can also chat questions at any time using the chat feature of WebEx. And again, *9 will raise your hand. Now I'd like to introduce today's presenter, Mayushi Simpson. Mayushi is a graduate of the University of Phoenix with a master's in healthcare administration, and Ms. Simpson currently works with the Alabama Quality Assurance Foundation as a performance improvement advisor. She, along with her colleagues, assists providers in the state of Alabama with meeting the quality standards in the merit-based incentive payment system, which is a Medicare Quality Program. She also currently provides assistance to hospitals in the state to meet hospital and clinic consumer assessments of health care, providers, and systems, the HCAHPS, providing ideas and technical assistance strategies to improve scores. And with no more further ado, I will turn it over to Mayushi Simpson.
Good afternoon, everyone. Hope everyone is having a great Wednesday. Once again, my name is Mayushi Simpson, and today we will be discussing ways to improve HCAHPS scores. The goal for today's presentation is to have a better understanding of HCAHPS, promote effective communication and coordination of care concerning the 11 questions, what an effective HCAHPS scheme, HCAHPS categories, ways to assist with reducing the use of opioids for pain, understanding how the grading scales are used for HCAHPS scores, and also to improve hospital value-based purchasing with HCAHPS, and also to examine HCAHPS scores per state among the Adam Alliance partners. So, our first part is to go over what are HCAHPS. HCAHPS is a 32-item survey to collect data from measuring a patient's perception of his or her hospital experience. Of these 32 questions, only 11 are available on Medicare Compare that will give the perception of his or her hospital experience. HCAHPS provides 3 broad goals. One of those goals is to provide protocol data to compare to other hospitals on topics that are important to the patient. Also, to provide public reporting of HCAHPS results, create new incentives to improve hospital quality of care, enhance hospital accountability in providing health care during an inpatient stay, which could affect a hospital's public investment. So, let's get started and get our brain going. Which 2 items are important to patients according to an HCAHPS survey? Is it star rating / quietness at night or communication / pain? polling box is now open on your WebEx panel. Please don't forget to hit submit when you finish answering the question, and thank you so much for participating today. Results will be up momentarily. So, to answer your question, which two items are important to patients according to an HCAHPS survey? The answer is communication and pain assessment. So, out of the answers, we have 16 out of 39. You are correct. Now we're going to go to our next slide. Effective communication with HCAHPS, as we just saw with the question that was the polling question, communication is one of those that is very important as far as delivering of HCAHPS. There are 4 strategies to increase hospital HCAHPS scores. As we just mentioned, communicate as clearly and as often. One way that you can assist with communicating clearly and often is to keep coming into a patient's room and providing information not only to the patient but also to the family. There's another way that you can also be able to keep communication clearly and often. The whiteboards that are in patients' rooms, if a patient by any chance may be asleep or a family member has not yet came back, only information that may be important to the patient's diagnosis, nothing that is in like lab results or anything like that, but just for example, the patient may have PT or anything that's able to be communicated to the patient and to the family as much as often will help a patient understand their health concerns, anything dealing with medication. It's a way of just communicating. Also collect data and devising strategies to improve processes. For an example, on the HCAHPS survey, there is one area that says cleanliness of room. By any chance, if that was to go back to that patient, if the patient or the family member collected that answer, once the answer was submitted in and the hospital realized that, hey, our scores are not as great in this particular area, the environmental service rep can then produce classes for the employees to have, or they can conduct one-on-one training in order to get those scores up. Educate patients on the importance of filling out the HCAHPS survey. Once again, if you make sure that you're going and you're reiterating the importance of HCAHPS, a lot of times the patient nor the family does not know what an HCAHPS is. If you explain this to the patient and to the family how important it is to get this information in to the hospital for them to be able to have a better process for providing information to patients and families, it's 9 times out of 10 it will get that patient's memory and the family member in knowing that, hey, let's try to figure out and get this done because that way our voice is being heard and make a positive patient experience part of the culture. One aspect of that is to provide leadership and being involved in the HCAHPS and also coming around to patients' rooms and just asking patients, are you comfortable? Are you being able to get the information needed medically? Is your provider saying what you need them to say? Are they giving you the answers to the healthcare needs that you're asking about? Also medication. Is your medication correct? Another observation is also to make sure that, to the importance, again, to stress to the employees and to the healthcare staff how important it is to truly keep this going as far as communicating with these steps and how important HCAHPS really are to a hospital. Another great way to try to assist with communication is to develop an HCAHPS team. An HCAHPS team will be a team of 4 members, or you can make it more than 4 members, depending on how big your facility is. But you can have a physician, 2 registered nurses, and a certified nursing assistant. The reason why I say physician and 2 registered nurses, one of the very first questions on the HCAHPS survey is, did your provider communicate with you the necessary healthcare needs? Did your nurse communicate with you on your necessary healthcare needs? Also, a certified nursing assistant can assist with the cleanliness of the room, making sure there's quietness, things that they can do to assist with the team to help make this a success. Once again, it's a team is more so to help with the building and the communication. And also, it's also another aspect to be able to assist patients and the family members to express, again, their voice. So now we're going to our HCAHPS categories. There are 11 categories, once again, that are on the HCAHPS survey that are available on Medicare Exchange. These are nurse communication, provider communication, assistance for hospital staff, pain assessment, educating of medication, cleanliness of bathrooms during stay, quietness at night, educating the patient or family member, recovery methods once discharge, patients agreeing that they understood their care while home, rating of the hospital, and recommendations for the family or friends. So, our next polling question. In the United States, the estimated percentage that use an opioid is between, is it 10 to 12%, 15 to 20%, or 21 to 29%?
And the polls are open, so feel free to answer as quickly as you can. We've got about 15 seconds to go. And don't forget to hit the submit button when you're finished answering. And we'll have the results up in just a few seconds.
So to answer the question, our polling question number 2, in the United States, the estimated percentage that use an opioid is between, the answer is 21 to 29%. Wow, you guys are on it. I see that you 24 out of 47 who are correct. It is 21 to 29%. Piggyback off the question that we just had, now we're going into this year, the pain assessment questions on the HCAHPS survey will now be changed. So effective January 1st, 2018, the questions were changed just to make sure that they're able to communicate the information differently to the patient, and that information will not be present until October 2019. Although the information is collected for this year, will not be ready until next year. The reason why they're changing these questions is to assist with the pain communication with the patient, to decrease the prescribing of narcotic pain medications, to prevent abuse among patients. Previous questions encourage providers to overprescribe to assist with a higher score, eliminate any potential financial pressures they feel to overprescribe any medication. As mentioned on this, a lot of times when patients were in, the patients would ask for pain medications, and of course, the provider would like to prescribe that medication for the patient to ease the patient while they're in the hospital. But now with the rising percentages of not only elderly patients, but patients 18 and older are now beginning to be addicted to these pain medications, which is now starting to cause additional issues, just being on opioids. So EMS decided to change the questions to redirect the questions for the patients not to basically want pain medication. So, for example, old pain assessment questions. These were the old ones. During the stay, the hospital stay, did you need medications for pain? During this hospital stay, how often was your pain well controlled? During this stay, hospital stay, how often did the hospital staff do everything they could to help with your pain? And these are the new questions. New questions, once again, have taken effect this year. And the questions are, during this hospital stay, did you have any pain during this hospital stay? How often did the hospital staff talk with you about how much pain you were in? During your hospital stay, how often did the hospital ask you about to treat your pain? So once again, that's basically about changing the verbiage of the questions for the patients not to say automatically, if you ask a person, hey, are you hurting? They're going to say yes. And now to redirect the question is now, instead of saying, would you like something for your pain, now they're asking the patient, did you have any pain? So it's pretty much changing the verbiage and the language to make the patient and the provider thinks before prescribing additional opioids. Polling question number 3. A low performance score will assist with hospital value purchasing, funding for your healthcare facility. Is that true or false?
And the polls are open, so please answer at your convenience, and don't forget to hit the submit button.
Oh, as we just mentioned, true or false? A low performance score will assist with hospital value purchasing funding for your healthcare facility. The answer to that one is, once again, that's false. 2951 of you all answer correctly. So yes, it is false. You do not want to have a low performance score with anything dealing with Medicare. As well, in some cases, you can have something scores be low. But in this case, you do not want any scores that are low in order to get your hospital funded for additional incentives. So, understanding how the grading scale works for HCAHPS scores. So, on an HCAHPS survey, there are 4 choices that you can choose. The first one is never. The next one is sometimes. Usually, always. You really want to encourage patients as much as you can possibly say if you choose always. But once again, the patient does have the right to choose how they're feeling as far as what they're saying. But once again, if we're going into the rooms and we're expressing to the patient how important these HCAHPS are, or also just reaching out not only the family members, but letting the family members see that you are actually caring. That actually makes a patient, not only a patient, but a family member, want to grade you higher. A lot of times the patient may be on medication and may not be able to pay attention to what's going on. But the family members are always there. They are alert. So just seeing that the staff cares really will make an impact on your scores. So hospital value purchasing and with HCAHPS. So with HCAHPS, the higher your scores are, the better you can possibly receive a small incentive. So information is collected by inpatient stay. So what that means, there has to be an inpatient stay. Also, the patient has to be over 18. It cannot be a patient that has been deceased. It also cannot be a patient that's been in a mental, like on a psych floor. It only has to be inpatient stays. It can be a one-night stay or it can be over a one-night stay. 8 of the categories comprise the HCAHPS score. A lot of those, I'm going to go ahead and let you know, out of those 8, the communication is always going to be the number 1. Communication, pain assessment, also making sure that the patient is also looking at the cleanliness of rooms as well. Hospital must score in the 50% percentile in each category to receive a full Medicare funding. So out of these scores, you have to have at least 50% percentile in each category in order to fulfill and get a receive Medicare funding. Patient experience domain scores, which consist 30% of HCAHPS scores. That is basically on your HCAHPS, there are different categories where you may have quality dealing with CDIF. The next one may be how you're rated in your flu vaccines as far as with that. But the very bottom is the patient experience domain. That's the area for your HCAHPS, and you want to try to make that as high as possible. So once again, just going in and speaking to your patient, having classes for your employees, making sure that they're aware of how important HCAHPS are, letting patients know when they're being discharged that you're going to receive a phone call from someone from a hospital or maybe a company. Also being able to provide additional assistance for patients that may be deaf and you have to have someone to do sign language, or it could be a patient that may not speak the language. You have an interpreter there. So once again, the more you can be able to communicate with patients and families, the higher your scores could possibly be. again showing how the HCAHPS are done for hospital purchasing. Once again, the patient experience domain is 30%. And that right there, if you have that 30% collected, your score could also be higher and you can receive that Medicare expenses. Once again, if your scores are in the 50% top, you automatically should receive some type of funding from Medicare. This information I collected off of the Medicare HCAHPS online survey. And it's basically each state that is represented by Adam line. So you have Alabama, Indiana, Kentucky, Mississippi, and Tennessee. Out of 3,349 surveys, I went through all of the categories and basically pulled what average each state is represented. So Alabama is a 3 out of 3,349. That means that we are marginal. Indiana going above going one notch above. Kentucky at a 3, Mississippi was a 3, and Tennessee is a 3. Not saying that these are bad. Actually, they're pretty good. But we can always do better. There's always room for improvement. Now, we're going to introduce our speakers for today. Each representative, we have a representative from Alabama, Indiana, Kentucky, Mississippi, and Tennessee. Our first speaker is Ms. Diane Myrick from Alabama. She is with Russellville Hospital, and she is the quality manager.
And if you are a speaker today, would you please press star 9 on your touch-tone phone to raise your hand, and I will take your line off mute. All lines are on mute today just to preserve sound quality, but star 9 if you'd like to have the operator take your line off mute.
Is our speaker press star 9 to get off again?
I'm not seeing anybody with hands raised yet. I'll refresh in just a minute here, but just go ahead and press star 9 if you would like to share today.
Were there others that had volunteered to share ahead of time?
No, sir. But I can speak on behalf of Ms. Myrick if you would like me to. Ms. Myrick
Let's do that.
yes, sir.
It just seems like we're having a little trouble getting around. So go ahead.
Yes, sir, I'm sorry. Ms. Myrick is the quality manager for Russellville Hospital. I met with her when we were going through her HCAHPS scores. One of the reasons why I chose Ms. Myrick to come on the presentation today is because her scores were outstanding for their facility. All 11 scores, they were above a 90. Also, they had a 4 out of 5 stars for their rating as far as recommending their facility. One of the things that stuck out to me the most with her providing education for her patient staff and family members is they will provide not only they will let them know at discharge that they will be receiving a phone call, but also they will provide little magnets with the hospital's name on it. Also, they have the actual number that will probably pop up on most caller IDs. So that way the patient will be aware that this is not a gimmick or it's a scam or anything of that nature. So it actually provides a number for the patient to know that that person is calling and why they're calling. Also, they will provide, they will do also follow-up call with the patient to see if the patient has filled out their HCAHPS survey. They will also ask if they have any questions with the survey. It was just the way that they went about as far as educating patients, also following up with patients. Those are things to me that represent the reason why they got those 90s and above for their HCAHPS scores. Once again, it's about, to me personally, about showing that you care about the patient, that you actually are listening to the patient, that you do want this patient to be able to express their voice with concerning their health care and their health care needs. But that is why I chose Ms. Myers, and I do apologize. I don't know why she wasn't here.
All right. I see several names of people I recognize from Indiana. That's where I am. I was wondering if any of them would be able to share some of the strategies that they've used to have high HCAHPS scores, or things that you're trying right now. Again, you just need to press *9 to get off mute, or you can post something in the chat. And names I recognize specifically, I'm going to pick on Cindy Mechanic or Andrea Coons if you'd be willing to share some of the strategies you're using.
Dawn.
Yeah.
Hey, this is Jill Raines at Greentown General. Just a little bit what we've done here to help increase our nurse communication is we are a little bit behind on the times, but we have initiated a bedside huddle and nurse rounding every hour, and that has definitely increased our nurse communication scores. I don't remember off the top of my head what they are, but it has definitely helped. And we also have initiated an opioid safety team, and so we have done a lot of education with our physicians about the HCAHPS pain questions and the changes, and I think our physicians are doing a better job of communicating that with our patients as well.
Thank you very much for sharing, Jill.
You're welcome.
Question come through on the chat. This is Justin. That asked, how often should a patient receive a survey?
Patient will receive a survey most likely every time they have an inpatient stay. So after their first inpatient stay, they're just wondering if they were actually go back to the hospital and to stay more than 1 day, they will get an additional one.
Okay, very good. Another question that came through from Lisa Dean Owens that asked where Miss Myra was located, that she has the 90% HCAHPS scores, and would she be willing to share an email for questions?
I truly don't think she would mind. If you would like to email me, I have my information on the very end of the slide. You can email me, and I'll be more than happy to share her information. She's located in Russellville, Alabama, and their facility is called Russellville Hospital. I think it's like a 120-bed facility, but it was just her scores were just remarkable, and I just really like the fact of how they created different ways. The magnet stuck out to me because a lot of times when you leave and you go from the hospital and you receive an envelope, the first thing you think is some trash and you throw it away. Well, on that magnet, it gives you every piece of information that you will see as far as your HCAHPS scores. So I have no problem with sharing her information. She's actually a book of knowledge when it comes to HCAHPS.
See, Andrew trying to join us on the call. Kara, do you see her opening the line?
I'm sorry, I don't see it. Would you mind pressing *9 on your touch-tone phone? Or, oh, there we go. Taking you off mute now. Okay.
Hi, this is Andrea.
Hi, Andrea.
I'm at Community Hospital of Bremen in Bremen, Indiana, which is a rural critical access hospital. We have also had some great HCAHPS scores. Part of the improvement process included bedside report and Ask 3, Teach 3, improving medication communication, which helped to bring up those and sustain those scores.
Okay. Thank you very much for sharing, Andrea. So now I picked on a few of the other providers from any of the other states that would like to share some of the successes or things that you're currently working on to improve scores.
Again,
Go ahead, Karen.
sorry, just go ahead and hit *9 and to raise your hand, and we'll take your line right off mute.
I'd also say if you don't have something to share, but if you have a question for one of the other hospitals that are on the line, something that you're trying to work on, looking for some input from peers, this is a great opportunity to get that as well. We can share challenges and see if there's something that we can help you improve.
Hi, caller from 205. Your line is off mute.
Hi. My name is Rachel. I'm calling from Walker Baptist in Jasper, Alabama, and I wanted to ask some of the other hospitals, what are they doing to increase their care transition scores? For those that have high scores, of course.
And I have another hand raised. I'm not sure if it's to answer your question or ask another, but let's keep both in the queue. And caller from 812, your line is off mute.
Hi, this is Janet Razor from St. Vincent's in Evansville, and I raised my hand before that question, so I'm not going to answer that question. But the tactics that we've used are really based on Studer. In the last 3 years, we've started with associate rounding, tried to get that down and hardwired, and moved to nurse leader rounding. That's like shift report. Recently rebooted hourly rounding and have seen a definite correlated increase in that score. And then finally we do our hospital safety huddle, but now we're asking each department, each nursing unit, and ancillary departments to do their own daily huddles. So what we found is that these tactics are evidence-based, and when we do them, and we do them well, and we see an increase in our scores and our patient safety and quality and satisfaction, the real issue is the sustainability and how to, orient each new nurse and make sure validate each leader is doing their associate rounding. So we work a lot on validation.
Thank you, Scott. And we have another caller from 574 area code, and your line is off mute now.
Yes, this is Andrea Kuntz again. Our care transitions, to the question that was raised about the care transitions, we have started with on admission, a patient folder, and as medication education is provided or anything that is dietary information, we start using that folder to organize and keep all their education materials during their stay. So at time of discharge, the folder is already in place. It has contact information. It has their med list. They have all their discharge instructions. And we advise them to take that folder with them to their follow-up appointments that were set, so that that next provider can see what the discharge instructions were at the time of discharge.
Thanks, Cicely.
Another person that has come through on the chat, this is Justin again, sir. That Jennifer Brewer is asking all participants, how do you monitor compliance of the hourly rounding in your facility? Anybody has some information to share on that? Press star 9. Unmute your line.
Hi, this is Nancy. The question again was could you repeat the question for me?
Yeah, she asked, how do you monitor compliance of hourly rounding? So I guess internally, like how would you monitor that?
Hi. Hi.
Yeah.
This is. Okay, is my line open?
Yes, we can hear you.
Okay, this is Janet Razor again from Evansville. The first time we did hourly rounding, 3 years ago, we did have a sheet that the tech or the nurse would complete, and we also include, well, let me just finish it. And then with our shared governance, the practice council voted to stop using the validation forms, and then we saw that the compliance went down. So when we rebooted our hourly rounding this year, we brought the sheet back, and those sheets are turned in to the nurse leader, who reviews them weekly to see if they are in compliance. We also this time included ancillaries, particularly physical and occupational therapy, because they often can do the 3 Ps when they are doing their treatment and do it. So we've seen a much bigger success in compliance this time.
Very good. And we have someone else on the chat asking, Kathy Hodge is asking if we could go back to slide 16.
The participants are able to move slides also. So if you want to go back to any of the slides from the presentation, you can click the arrow at the top of your screen.
I was just wondering, Kathy, did you have a specific question about this slide? You can either type it or you can press star 9 and come on the call. I really do feel like we're having a great discussion here, and I'm really happy to see the sharing. It's one of those situations where no one has all the answers. It's such a huge field that when we get together, each of us has a little bit of it, and it makes a big difference.
Okay, it looks like she's came through here. Says, can you explain the methodology of star rating and top box?
Yes, this is Yoshi. So the top box methodology, as you can see on the other side, is basically showing the highest score. So basically, it's saying with the top notch, a lot of facilities, but when I was doing my research, a lot of facilities did not capture anything that was not a top box. So if it did not have a 4, they pretty much would discard it, and that you really truly don't want to do that. You really want to take everything in. But a lot of facilities, when I was doing research, sometimes they would not include those 4s. So what they're saying would not follow top notch. But that's basically what it is. They were choosing the best 4 instead of using all the surveys that was submitted. They only wanted the top scores. So they're just recommending that you don't select just those that are very, very good because, once again, you want to be able to address all issues and situations.
Okay, Kathy, does that answer your question? So, yes.
I'm not seeing any hands raised at this time, but again, if you'd like to share, star 9, please.
I just want to see you posted a few tips in the chat as well. Some of the best practices that we found.
Yeah, absolutely. And I just wanted to put it there just in case, instead of just reading it so that people could follow along with it. But just some 3 quick tips that we found to help with the patient experience of care. Number 1, of course, don't focus on the numbers. When working with staff on measures that focus on the patient experience. Involve the staff in the planning. And staff meetings involve leadership and staff collectively. Come up with a plan to encourage greater ownership of change. If you get their buy-in from staff, it's more likely to get compliant. And then get to know your patient. Encourage each nursing staff caring for a patient share something about the patient that can't be discovered from the medical records. I've worked at other facilities where they have things like the My Story kind of thing, where they'll ask patients are given a questionnaire where, the patient could tell things, maybe how many grandchildren they have, or those kind of things to make the relationship more personable. Those are some suggestions.
Thank you, Justin. I'm going to give another opportunity for people if you have a question you want to raise to the group. This is a good chance to do that, or if there's something that you're working on that you think is having some good success and feel like sharing. Again, either press star 9 to raise your hand and share that verbally, or you can post it in the chat as well. Karen, do we have anybody in queue?
No hands raised at this time, then.
Maya, do you want to go back to the contact information?
Yes, sir.
Hey, while you're going back to there, I do have a question here from one of these. It says that we are a small 33-bed hospital in rural Tennessee that have trouble with patients returning their surveys. In fact, that we don't receive enough back to even have a star rating at this time. And they're asking for suggestions on how to raise those numbers. If there's anybody on the line that has some kind of suggestion on how to get more people to send those surveys back.
Yoshi, I have a suggestion. One thing that you could possibly do by you all being small is if you have someone that's able to follow up with patients that have just been released or discharged from the hospital and ask, by any chance, have they completed their survey? And if so, have they mailed it? That way it's kind of like in their mind, like a reminder. Because a lot of times when we have things that we're going to mail back, sometimes we'll have it completed, but we sometimes forget because, of course, life takes on. So if there's any way that someone can kind of a reminder, a phone call to the patient, or if they have someone on their information form on the HIPAA form, possibly they can call that person if they've elected to be their representative and call and ask by any chance as your family member has the opportunity to complete our HCAHPS. And if so, is it possible that they can have it mailed back to us? That's a small suggestion.
Okay, very good. And then we have another comment that looks like it's coming from Robert Massey. That says, earlier we were talking about calling patients after discharge. What is the recommended time frame to call them back? At his facility, says that we've been trying to reach 24 to 72 hours after discharge at his facility, but we're unable to meet that goal.
This is Nancy again. In times of that nature, a lot of times I would try, if you could. I know we try to get it in as fast as we possibly can, but if you could try to extend that time for at least a week and do a phone call at the beginning of the week, or when the patient is discharged, like 24 hours after the patient is discharged, and then wait at the end of the week. That way that the patient is settled and the family has the patient settled as well. You can follow up with a family member or that patient at that time. And that way it can be a reminder. If the patient hasn't had opportunities, pretty much a reminder again, have you had a chance to look at your survey? And then when the patient's being discharged, to also let that family member know if the patient is not able to understand, then that family member know, or the person who's going to be taking care of them, let them know that a survey will be coming to their home either by mail or it could possibly be a phone call. Or it could be a combination of both. I just once again just reiterating that to the patient family that's possible that you can help. But once again, I would try to extend it off to a week, call at the beginning of the week, and then try again at the end of the week.
Very good. I think we've got another comment here in the chat. And this is from Rakita White. It's a suggestion to get some surveys back. So they do leader rounding and let them know that they will be getting a survey in the mail after discharge. We'd love for them to complete and return it to help us know how we did and how we can improve. That's a very good point, Rakita, to put that out there, to let them know that to be expecting something like that. The importance of sending that back so that if there is areas for improvement, that you can get that back to your facility so we can make those.
Anyone else at the clear?
Not at this time, Don.
Okay. Saying the same thing. And Justin, no other questions in the chat at this time?
I'm not seeing any other questions at this time.
Actually, let's take us to the next slide. Just a few additional ways that you can connect with us here at the ATOM Alliance. And I want to give a big thank you to Myercy for speaking today. And then for those hospitals that joined in the conversation, both verbally on the call and in the chat, that's a huge part of the power of these calls. It's not just the information that we have and can share, but it's the network and the sharing together. So I think that was really great. We had a lot of speakers join in. We'd also like you to contact us if you have any questions about what you've heard today, or you need some technical assistance at your facility, either on HCAHPS or other quality improvement initiatives. The ATOM Alliance is here to help. We'd also like to ask you, and this is a timely topic with our HCAHPS survey today, we'd ask you to complete a post-event survey, and your feedback really does help us shape future Learning in Action Network events, both in format and content. So we look for your feedback on that. You should be getting that, or as soon as you close this webinar, you'll be taken to the survey. This call was recorded, and it will be posted to the atomalliance.org website. We also welcome you to connect with us through social media for more opportunities to network with us and to engage. Thank you all for joining us, and have a great afternoon.